Michelle, you're the chief nurse of a leading children's hospital. Why are you and your colleagues supporting our campaign for adult hospitals to welcome the carers of people with dementia?
Why we believe that it's so important about families visiting and families being part of the care is actually we see the results of that. So we work with children and young people day in and day out, and we see the impact of them having their family makes on their recovery. And the impact that makes is they get better quicker. So we genuinely believe that having the family as part of that partnership arrangement actually allows them to get better quicker, they get better in the right way, and also if you're having true partnerships in care, we're just one little section of that whole journey of that child or young person getting well. The biggest section is when they're in their home. So it's when those children and young people are at home and those families are looking after them. So we need to empower those families to be able to do that at home. And why is that any different what age you are? Whether you're a baby or whether you're somebody that has got a frail elderly relative, why is that any different?
You've been a nurse for 30 years. You've worked as an adult nurse, a community nurse, and for the last 15 years, you've been at Birmingham Children's Hospital. Would you say that a children's nurse needs to have a completely different approach?
I think you always start off with the principle that the family are part and parcel of all the care. So we talk about the care we give to children, young people and the families are just important. So it's almost if you start off with that principle, then everything else flows from it. So we know that when you're looking after children, there will always be somebody watching you. And for our young nurses coming through and our young student nurses, that can be quite off-putting because you've always got somebody there, and it's actually teaching them to have the confidence that they don't need to know everything, that there are always times and people that they can ask, but also having that confidence that that parent will always know that child better than they will, always. So we know our children better than anybody else. So it's encouraging them to have the confidence that to listen, because listening is so crucial, to pick up those vital cues from that caregiver, which is often a family member, and also to enrich the care they give by ensuring that it's true partnership working.
Are you more person-focused, less task-based?
So I'm an adult nurse, and as you said, I'm also a district nurse and I'm a children's nurse. So the bottom line is I am a nurse. So the fundamentals of caring are always there. Somewhere along the way, because of how things have developed, the principles are slightly different depending upon which care setting you're in, and that's really interesting to look at that. So I had a conversation with my 92-year-old aunt at the weekend, and she was talking to me about when her son, who was 4, was in hospital 60 odd years ago, that she was allowed to come in 1 hour a day, and she wasn't allowed to come in on Tuesday because that was a cleaning day, and therefore no relatives were allowed on that cleaning day. Now, as you said, we've campaigned so that we've now got a position where it's completely open. We're not perhaps that far advanced in some of our adult settings, and that's where we need to be. So that we need to share how we can improve care by including families through that journey, and that's what I think we could probably help with. We all have the same safety standards, so it isn't that we don't have to consider those safety standards, whether it's safety or clinical effectiveness. We still have the same things to make sure that we have the right care. So we have to clean just as much as any adult hospital. We have the same issues as any other adult hospital. I mean, we're in an old Victorian building, absolutely gorgeous, but we've got those long Nightingale wards, so no cubicles, so we're not in that particularly privileged position, but the principles we look at to ensure that we can include visiting and visiting's open, so the standards we maintain are exactly the same as you'd see in an adult hospital. So there are things that we've developed from our guiding principle. So I guess what I'm saying is if you stick to the principle that families are partners in care, that there will be open visiting, that families will work together for the right outcome for care, every other issue you have can be resolved. So whether it's an infection control issue, whether it's a too many visitors issue, whether it's the times, everything can be resolved if you start off with that one principle.
So how many people do stay overnight with you?
On a lot of our wards we can have up to 20 children or young people on the wards, and up on those wards we can have 20 parents staying. Is it tight? Of course it is. Are they going to leave their children when they're sick? Of course they're not. Does it mean that we need to make sure that they are supported, they have the facilities? Yes, of course we do. But if they're looked after, then they're looking after their children, so it's all part of that care continuum.
But your visiting isn't exactly a 24-hour free-for-all.
So there is always an element of management to anything that you do and we do. So for example, just as I've said, we negotiate the care. You negotiate that with the families, and you know what, people are really sensible. When they know that you can visit and you've got the day, then they work out who is coming and when, which is great. So the child gets that stimulation and gets that chat in. Rest is crucial. So just as if you're an adult or a frail elderly person needs rest, then our infants, children and young people of course need rest. So what we do is for our neonates, our little ones, they really need their rest. So we have quiet times in the afternoon where the lights go down, people talk in a hushed voice, and we try and restrict what goes on those areas at that time. Now, have we ever said to the families that they need to restrict visiting then? No. Have the families restricted visiting then? Yes, they have, because they recognise that's the quiet time, and what often happens is dad or mom just cuddle the babies during that time and let the babies rest. And we do exactly the same in our intensive care unit. So in the afternoon we have 2 hours where lights go down, everything calms down, and we've never said we've restricted visiting to some of our sickest children, but do the families naturally keep it that only a couple of visitors come? Yes, they do. So we just need to ensure that we do respect the visitors to do the right thing, and if you're working in partnership, the results are that's what happens, the right things happen.
You use your families quite proactively, don't you?
We've got our paediatric early warning system, so that's a whole variety of blood pressure, temperatures, pulse, whole variety of different ways of monitoring that child's care. At the bottom of those charts, we've actually put in a section, so are the families happy? Is there some element of care that the families are concerned about? And the reason we did that is it goes back to what I said previously, that the best person that know their child are their parents. They know their child better than we ever will. And it's about listening and having those conversations. And often families can say, you know, Michelle, I know he's just not right, but I just don't know what it is. And that's the bit, and that's the listening skill, and that's the bit that needs to go on, so that is taken seriously. It's taken seriously as a concern, and we put that down to make sure that when our senior nurses, our senior nursing team or our senior medical team come and look at that, they say, well, why isn't that mum or dad happy? Let me just go through this again, let me just check on this. So it gives you that just extra check.
Is there any single message you'd like to give to your colleagues in other nursing sectors?
I guess that the only message I would give is start off by the principle that it's important that whether you call them your patient, your client, your child or young person, your adult, however many terms we use, the principle is it's important that they have their family around them to assist in care, to assist you to deliver care, and to make sure that care continues when they go away from you. If you start off with that principle, it's not that the journey isn't going to have a few bumps along the way, but actually all of them can be overcome by just sticking to that principle that that's the right thing to do. And when you do the right thing, everything else follows on from that.